And we really need to throw a lot of money at training mental health practitioners, because if we've got the mental health practitioners trained, then they can see it throughout society and start to train everybody else. So we've got a problem in the family court where we've got a legal system and a mental health system crossing over, and they shouldn't really be. We should be sending everybody out to the mental health stream if there's that stuff going on in the legal system, because the legal system aren't trained. And it turns out a lot of the mental health practitioners aren't trained to deal with it either. So we've got to throw a lot of money at training mental health practitioners and how to identify adult child survivors, because this gap is so big. And when I work in the mental health units and go up into the emergency departments, we've got adult child survivors wandering around everywhere begging and pleading for help, but there is minimal help out there. And I can go into the mental health units and the jail systems. There are adult child survivors of psychological and physical abuse everywhere. There's a sea of them, untreated people. So, and we often will just treat the presenting symptom. So it could be drug addiction or, anger, or all sorts of things, you name it, instead of actually looking at the child trauma, which is what you touched on earlier. We need to be trauma informed therapists and understand the deep level trauma that has happened within people, and understand the intergenerational trauma and how that's contributing. So this huge gap currently exists, which we identified, and that was what I was referring to, Patty.
And I was on the board of directors for 8 years for the Domestic Violence Project, and our small inner circle group there was hospital based. I was very, very, very fortunate where we were located, and it was such they would fit in real well right here with the professionalism and everything. And one of the protocols in the hospital is to ask immediately, do you feel safe? Are you safe to go home? And that was taken seriously. There was immediate action. So it makes me wonder, you would not be released or sent back to that. You would have the social workers and the police, and they would really have a team to support you. So clearly that is not the case in all areas, in all cities, in all states. And why, I guess this is my question, to throw it out to the legal system, why, and the medical community, why can there not be one protocol, one set of protocol? This is how it needs to be. This is what works. And I mean, fortunately, we had a heart surgeon who was phenomenal at the hospital, that was a great deal part of the Domestic Violence Project. But it's not acceptable to have someone say, I don't feel safe to go home, and then send you back to that place.